Excellencies, ladies and gentlemen, first of all, I would like to say what a great honor it is for me to be before your assembly to present my candidacy for the post of Director General of the World Health Organization. My professional life has been devoted to two fields of activity: medicine and politics. In the medical field, my passion is public health. I am an epidemiologist working on cardiovascular risk factors and particularly on cholesterol levels. That has led me to become a professor of public health at the University of Paris and a visiting professor at Harvard, the Harvard School of Public Health in Boston. In the political level, I have had many responsibilities at different levels. First, the local level, the municipal level. I like the local level because we can work concretely on the ground. I was mayor of Lourdes, and after that I was mayor of Toulouse, one of the French biggest cities. I was in charge of 10,000 civil servants, and I managed an annual budget of $1 billion. At the national level, I was Minister of Health on 2 occasions, but the last time, in 2004, I carried out one important reform of the French health insurance system, making savings of more than 7 billion euros a year. And I implemented this reform without provoking strikes, which is, as you know, very difficult in my country. At the international level, I was Minister of Foreign Affairs between 2005 and 2007. During that period, I created 2 things. First, the group Diplomacy and Health, to enhance the importance of health in foreign policy. On the other hand, I created UNITAID, U-N-I-T-A-I-D, an international organization hosted by the WHO. It is the first laboratory of innovative financing. And the idea at that period was, innovative idea was to add $1 or €1 per plane ticket. It's painless for the state. The traveler has to pay $1 more. But with this money, first, I convinced a dozen of countries in the world. And with this money, we raised more than $2.5 billion. And with this money, we reduced the prices of drugs, medicines, and diagnosis tests by 80% for antiretroviral for children, by 60% for second-line antiretroviral, and by 60% for malaria and test diagnosis on TB. I speak about that at the beginning of our presentation because I think that the budget of the WHO needs sustainable, predictable, and additional funding. And innovative financing are like that. Still, on the international level, I worked a lot with the United Nations. I was appointed Under-Secretary General in 2008, and I am the special advisor of the Secretary General for Innovative Financing for Development. Excellencies, ladies and gentlemen, it is my first speech to your assembly. And I would like to thank you for allowing me to present my vision of the WHO and essentially my strategy to renew the WHO leadership in global health. To make this vision a reality, we have to strengthen the WHO internally and to strengthen the WHO externally. At a time when health crisis, new health crisis, threaten the world, the international community it is absolutely essential, critical. We need the efficiency and the authority of the WHO more than ever. At the world level, in my point of view, the WHO has to be the organization who defines health as a political priority and not only as a technical priority. As a political priority, not only because it is a human right, but because it is the best investment for the development, for the economic development of a country. To make this possible, we need absolute confidence between the WHO and its member states, you. And to enhance this confidence, we have to implement 3 R: responsiveness, reform, and results. My first priority will be responsiveness, would be responsiveness. You adopted, during the last World Health Assembly, the emergency program. We have to implement it quickly. For that, we need 3 actions. First, secure, reliable, long-term funding. 194 countries adopted this program, and they have to contribute according to their means. Otherwise, the WHO has to work with member states, but also with major donors, with the World Bank, with IMF, with all relevant partners, to coordinate, harmonize the budget for the program, but also, please, to avoid proliferation of funds. The second action we have to do is to provide the WHO leadership for the responsiveness. For that, we have to co-locate 2 functions of the WHO: the preparedness function and the emergencies response functions. We have to co-locate these 2 functions. And also, we have to set up an independent advisory committee. And this committee must review all the decision-making and all the responses to disease outbreak. And finally, and essentially, if we want to have the leadership of the WHO in emergencies response, we have to engage partners. First, with the UN agencies, and particularly with OCHA, UN OCHA. So we have to ask the WHO and UN OCHA to implement a very strong partnership with information sharing mechanisms. We have also to implement a partnership with NGOs. During the last Ebola crisis, we saw the importance of NGOs and particularly Doctors Without Borders. And when there is an outbreak, I think that the convening power of the WHO has to play a big role. The WHO has to convene governments, industry, but also donors and researchers to contribute to accelerate the development of urgently needed drugs. The last action for the responsiveness is to prioritize support to countries on the ground. The WHO must have a strong frontline capacity at the regional and the country levels. This will involve a decentralization of budget and staff to regions and countries which are the most in need. It is my proposals for responsiveness. Second, reform. The WHO must function with clear lines of accountability between the Director General, regional directors, and country officers. And also we have to deal with the GPG, the Global Policy Program, in depth. So first, the WHO has to, if we want to build the accountability and the credibility of the WHO, we have to set up a new, flexible, efficient, and modern human resources system with a workforce of world-class experts, internationally recognized, capable of deploying staff and to countries which are the most in need. Second thing, we have to set up an audit function, strong audit function, knowing that the audit recommendations have to be implemented swiftly, fully, and quickly. The third R is results. I think it's the most important and the most difficult to do. We have to consistently demonstrate the efficiency of the WHO. So the WHO cannot do everything. We have to prioritize. So we have to make our choice with member states. We have to choose priority because, for example, the WHO has a very good comparative advantage for this activity. We have to prioritize or deprioritize more aggressively and to communicate why, because results. And we have to go from a budgetarian culture to a culture of accountability. And during the budget 2018 and 2019, I think that we have to be more transparent and little by little to link finance to results. But we cannot speak about efficiency of the WHO if we don't speak about partnerships with vertical fund. WHO, Global Fund, and Gavi, for example. The target is the same, is to improve global health. But Global Fund and Gavi have a lot of efficiencies, modernization of the human resources, modernization of the organizations, and money, by the way. And the WHO has to, find out, has to define partnerships with vertical funds. It is, for me, absolutely crucial. Now, if you accept, I am going to shift to French, because I do think that the WHO also has to defend the multilingualism. Je vais donc parler.
Therefore, I will now speak in French, and I will address different topics that are dear to my heart. We need to strengthen health systems.
Les maladies non transmissibles.
We need to address non-communicable diseases, universal access to medicines, and antimicrobial resistance. All this in the space of 15 minutes, I think.
D'abord, les renforcements des systèmes de santé.
However, let me start with strengthening healthcare systems.
La chose la plus importante pour l'OMS.
That is the most important thing for WHO. In other words, fact, we need to remind commitments taken at Alma-Ata 40 years ago. Health for all. We need to strengthen primary health systems and also at the community level so as to set up universal health coverage.
Il y a des dizaines de millions de pauvres qui n'ont pas.
Dozens of millions of poor people do not have access to midwives, doctors, nurses, healthcare professionals that are qualified, and therefore to reduce the child and maternal mortality rates, to allow the most vulnerable populations to have access to care, women, children, individuals living with HIV/AIDS, mentally diseased individuals, palliative care patients. This is the only solution.
Deuxièmement, l'OMS doit être
Secondly, WHO needs to be the organization that requires integration.
De la santé publique dans les systèmes.
The integration of public health in healthcare systems. For me, public health is the most important pillar of medicine.
Nous devons revaloriser les.
And therefore, we need to give value to healthcare workers with respect to wages, with respect to their training, and so forth. This is absolutely essential.
Troisièmement, si nous voulons renforcer les systèmes de santé, vous savez, j'ai fait.
Thirdly, if we want to strengthen healthcare systems, you know, I've carried out about 95 visits in different countries. I've spoken to ministers of health, and I know they need greater budgets, because you can't strengthen healthcare systems without bigger budgets.
Et également les aider pour les financements innovants.
And we also need to help them with innovative financing efforts. I would also create a department or a task force on innovative financing within the organization to precisely be able to help countries as well as WHO's budget.
Enfin, quatrièmement, je ne peux pas terminer sur les
And lastly, I can't leave this issue of strengthening healthcare systems without talking about a worldwide task force to improve the health of migrants and refugees specifically.
Des pays seuls qui reçoivent.
We can't leave countries to their own devices. They're receiving tens of thousands of refugees without any sort of worldwide source of aid with regard to epidemics, vaccinations, and treatment of communicable diseases, of NCDs.
Un des grands problèmes de santé publique sera les violences faites aux femmes et aux enfants.
Another major challenge is the violence against women and children. We have to recognize that this is a major public health problem, and therefore it requires specialized public health workers to prevent and to be able to react in the face of these human rights violations.
Enfin, nous devons inciter les pays à mettre en place des systèmes.
Lastly, we need to encourage countries to set up information systems, because gathering data is absolutely essential if we're going to do proper epidemiology studies.
Maintenant, nous passons aux maladies non transmissibles.
Now I want to talk about NCDs. Here we're faced with a bit of a paradox. On the one side, you have diseases that are the most deadly, 14 million people a year of less than 70 years of age, and then on the other side, there isn't much political will. There is the beginnings of a political will, but not much, to be honest.
L'OMS doit rappeler les engagements.
So WHO needs to remind states of the commitments already taken. I'm thinking here of the Global Action Plan that you have already set up for NCDs. I'm also thinking of the Interagency UN Task Force on NCDs.
Deuxièmement, et c'est là où il me semble que l'OMS.
Secondly, and here I think WHO has played a political role. We need to properly understand that health isn't only ministries of health. Health is a far broader subject. The health agenda is enormous. And therefore we need to be able to talk to governments, we need to be able to talk to industry actors, we need to talk to patient associations, we need to be able to include NGOs.
Permettez-moi de vous dire que quand on parle à l'industrie,
and allow me to say the following: when we talk with the industry has an enormous impact on NCDs. I'll address the issue again later. So we need to set up standards.
Cette maison est légitime.
This institution has the legitimacy to enshrine these. This is a standard-setting organization. It can set up these standards for fat, for salt, for sugar, these standards do not exist on a worldwide basis. Different countries have different standards. And as regards to NCDs, we also need to talk about public health.
Éducation pour la santé.
I'm referring to prevention, education, promotion of health. This goes to speaks to testing and to early diagnosis. This also leads to early care and prevention. So prevention is absolutely essential as well. Risk factors such as smoking. We need to ask all countries to sign up to this convention that dates back 10 years now. But they also need to sign the WHO agreement on trade in tobacco.
Ensuite, il faut se battre avec peut-être aussi l'agroalimentaire, sur le sucre.
We also maybe should fight on more specific issues such as salt, sugar, and so forth, but not one person in this institution should have a conflict of interest with the industry. There should be no conflicts of interest.
Si on veut lutter contre l'hypertension, si on veut lutter contre l'obésité des...
If we want to fight against high blood pressure, child obesity, diabetes, cardiovascular diseases, cancer, we need to carry out this preventative work here.
Par l'accès universel aux médicaments.
And I'll wrap things up with the following. Universal access to medicines. This universal access to medicines, well, I've spent 15 years of my life on this topic. I've reduced the price of medicines quite simply by playing on market dynamics. That's simple.
Si vous voulez rendre abordable tout.
So, first and foremost, if you want all innovative medicines to be affordable, you need to play with these market dynamics. Secondly, you need to ask pharmaceutical companies to keep the old and effective medicines, because sometimes they do work. They're not being purchased in rich countries, but they work very well. So they need to still be produced and distributed.
Et enfin, troisièmement, lorsque les médicaments ne sont pas rentables, eh bien,
and thirdly, when medicines are not affordable, well, at that stage, we need to find a way, a system with respect to forgotten tropical diseases, child diseases, and so forth. WHO should have a platform right here in this institution in Geneva to urge the pharmaceutical industry to set up not affordable medicines that can make them affordable and to find solutions.
Dernier point, la lutte contre antimicrobiorésistance.
Lastly, the fight against antimicrobial resistance, AMR. There's been a very good report produced, but it'll be very difficult to implement all its suggestions. This is a major topic.
Il y a trop de demandes et il n'y a pas assez d'offres. Trop de demandes sur prescription, des mauvaises prescriptions.
There is too much demand and not enough supply. There is also the problem of overprescription, bad prescriptions. In many countries you can buy antibiotics without a prescription. So what I would require is a worldwide campaign led by WHO, because once again, health goes beyond issues of disease. We need to have a worldwide campaign that sets up human medicine, veterinary medicine, that looks at livestock, agriculture, trade, financing, consumers, as well as the environment. This is the only solution if we're going to fight against AMR. Whenever we eat meat or fish, we're actually ingesting antibiotics. And we also need to address supply. For 20 years now, the pharmaceutical industry doesn't generate antibiotics because they don't make any money with them. So I come back to the problem I mentioned earlier regarding essential medicines. In this institution, we need a platform. Quite obviously, we need this innovative center for financing, and the WHO needs to play a key role here.
Nous l'avons fait, nous, avec un financement innovant qui s'appelle le Medicines Patent Pool, la communauté de brevets.
We did it with the Medicines Patent Pool, and we need to continue to innovate.
Recherche publique.
Hand in hand with the industry, with researchers, with public individuals from the public sector to find those medicines that we don't have today. We need to work with the experts that know how to do it. The World Bank has also had similar initiatives. We need to work with Unitaid, with the Medicines Patent Pool, with FIND, with PATH. These are people who are experts, who know the problem inside out. And here I really want to congratulate the directors and the teams that work on the problem of AMR, because it's truly an example of outstanding work carried out in this institution. I'm not sure how much time is left. How much time do I have left?
5 minutes. Voilà, donc je voudrais juste terminer en vous disant que pour moi c'est une étape excessivement importante.
So I'll just wrap things up by saying that for me this is an important and indeed a crucial step. WHO has a special, unique legitimacy. WHO is a universal institution covering health.
L'OMS parfois est attaquée.
And I believe that sometimes WHO is under attack. We need to be very wary here, because if we don't carry out the reforms I highlighted at the beginning, and I know that many of these reforms are already underway, the Health Emergencies Program, that's already a bit of a revolution.
D'autority, accountability.
With lines for accountability and authority that are clearly delineated. So you've already started, but we need to go even further, I believe. And I think that's the work for the future DG, to maybe do fewer brilliant things, but to really be in the engine room.
Regagner cette crédibilité.
Working to rebuild and to regain this lost credibility, because without this, I will tell you what's going to happen. And I've discussed this with many member states, some of the major donors even, and they've told me that they will reduce their donations until we reach a critical level. And then there will be a major credibility problem.
Et moi, j'aime tellement l'Organisation mondiale de la santé comme vous, sinon vous ne seriez pas ici.
And I love WHO as much as all of you, otherwise you wouldn't be here, and I believe we need to defend her. And we also need to address the issue of fragmentation. Gavi, Stop TV, Rollback Malaria, all of these are examples. UNITAID, I'm also an example of this fragmentation process. So we need to fight to make sure that this house remains the heart, the center, where we talk about health in broad strokes. Finally, you can't end the presentation on WHO without mentioning the billions of human beings that do not have the same access as the wealthiest among us. This is our topic. Cancer was mentioned earlier. I made a presentation at the World Cancer Summit with many ministers of health. How are we going to be able to pay down the road chemotherapy treatments, individual treatments in the poorest countries? This is a major subject, which is why we need to set up this innovation, be it in terms of funding or spending. We need to invent new forms of finance that allows us to have more resources, and maybe also we need to do more with less, work on added value. Obviously, every dollar, every euro in this institution needs to be well spent.
Et parfois, lorsqu'on voit qu'on peut, avec des licences, par exemple,
and sometimes when we see that with certain licenses and so forth, respecting intellectual property and so forth, we can make a lot of money simply by reducing the prices of certain line items with respect to the poorest countries. So I'm thinking about these people. It's been my life's work. I've spent the last 15 years of my life working for the poorest. Thank you very much.